If you've ever worried about your heart quietly struggling, you're not alone. And I want to start with something you might not expect. The number that most people obsess over, the cholesterol reading on a standard blood test, often doesn't tell you the full story. What really matters is happening deep inside the walls of your arteries. It's about how flexible those vessels remain and whether sticky, oxidized debris is silently hardening within them. Here's a truth I wish more people heard during a routine checkup. You can walk out of your doctor's office with a perfectly normal cholesterol panel and still carry a dangerous burden of arterial plaque. Not the stable, harmless kind. I'm talking about the kind that can suddenly rupture, causing a heart attack in someone who was told they were completely fine just 6 months earlier. It's shocking, it's silent, and it's far more common than we like to admit. But I've also witnessed something deeply hopeful over my years in medicine. The same biological machinery that builds that plaque can be gently redirected. With specific compounds found in everyday foods, you can actually help your body begin breaking it down. And there's a particular window in the morning when your vascular system is uniquely receptive to that shift. Today, I'm going to walk you through exactly what to drink each morning to activate that process. My name is Dr. Meilin. I'm a physician with a background that blends emergency care and cardiovascular preventive medicine. For over 15 years, I've stood at a very unique crossroads. I've seen people rush in during their most frightening crises, and I've also watched others quietly sidestep that crisis altogether. That contrast fascinated me and drove me to ask a single question. What are the people who avoid heart attacks actually doing differently? The answer wasn't always found in a prescription bottle or a surgical procedure. Often it came down to consistent daily habits, small choices that kept their internal vascular environment hostile to plaque formation. Nothing exotic, nothing expensive, just specific, science-backed inputs, often taken first thing in the morning that primed their arteries for repair rather than deterioration. That's what we're going to explore together. I'll show you why plaque builds up in the first place and reveal one hidden driver that is rarely addressed. I'll explain the exact biological mechanism that allows your body to begin dissolving and stabilizing arterial deposits. We'll build a specific morning drink together with precise doses supported by peer-reviewed research. I'll give you for additional foods to pair with it for compounding vascular benefit. I'll cover the 3 timing mistakes most people make that completely undermine their results. And I'll leave you with a simple 4-week protocol you can start tomorrow. No prescription required. Before we dive in, I have a small favor. I often hear from viewers who have watched several of my videos without realizing they hadn't yet subscribed. If you could take just a quick second to check, it costs nothing and really helps this channel reach more people who are genuinely looking for science-backed health information, not just frightening headlines. I'd truly appreciate it. Now, let me paint a picture of what's actually happening inside your arteries, because most people deeply misunderstand the process, and that misunderstanding is precisely why so many interventions fail. Imagine your arterial wall like the inner lining of a high-pressure garden hose. When that hose is new and flexible, water rushes through it smoothly, no matter what you push through, but expose that same hose to constant friction, intense heat, and chemical irritants over many years, and that inner lining begins to crack and roughen. Once that happens, debris starts to stick. Fats, immune cells, calcium flux, they all cling to those damaged spots. This is essentially what happens in your body. The inner layer of your artery, called the endothelium, is breathtakingly delicate. It's just one single cell thick. Under ideal conditions, it secretes a magnificent protective molecule called nitric oxide. This molecule keeps the arterial wall relaxed, slippery, and resistant to deposits. But when that precious endothelium becomes inflamed, whether from oxidized LDL particles, chronically elevated blood sugar, or persistent low-grade inflammation, it loses its protective ability. The walls become sticky, and that stickiness is the open invitation for plaque to take hold. But here's the surprising part that almost no one talks about. The plaque itself is not just a passive waxy buildup like grease clogging a drain pipe. It's a living, metabolically active structure. It contains immune cells, smooth muscle cells, cholesterol crystals, and a fibrous cap covering it. A stable plaque, even if it's quite large, might sit there quietly for decades without causing harm. But a vulnerable plaque, one with a thin, inflamed cap and a lipid-rich core, can rupture with almost no warning. That rupture triggers the clot that causes a heart attack or a stroke. So the real target isn't just to lower a cholesterol number. The target is to reduce oxidative stress on your endothelium, restore that precious nitric oxide production, suppress the inflammatory signals that make plaques unstable, and support the enzymatic processes that gradually reabsorb those deposits. This is a very specific biochemical job, and certain compounds, when consumed at the right time and in the right doses, are remarkably well suited to do it. Let's walk through the 4 mechanisms that make this possible. The first is nitric oxide restoration. Nitric oxide is arguably the single most important molecule your arteries produce. It signals the surrounding smooth muscle to relax, which widens the vessel and reduces pressure. It also coats the endothelial surface in a way that physically prevents platelets and oxidized fats from gluing onto it. When nitric oxide production drops, which happens progressively with age, inflammation, and a poor diet, your arterial walls stiffen. Plaque adhesion accelerates dramatically. Certain polyphenols and amino acid precursors directly upregulate the enzyme responsible for nitric oxide synthesis. It's called endothelial nitric oxide synthase, or NOS for short. Think of NOS like the main valve operator in a municipal water system when it's working. Water flows freely. When it's shut down by oxidative damage, pressure builds and debris accumulates at every joint and bend in the pipe. The second mechanism is reverse cholesterol transport. This is the process your body uses to pull cholesterol out of artery walls and return it to the liver for elimination. It depends on a molecule called HDL, but it's not just about the quantity of HDL. What truly matters is HDL's functional capacity, specifically its ability to pick up cholesterol from foam cells embedded in plaque and escort it safely away. Certain plant compounds enhance this HDL functionality rather than just raising its count. It's a distinction that most standard lipid panels miss entirely. When reverse cholesterol transport is working efficiently, even existing deposits can begin to shrink. This is the biology behind plaque regression. It's real, it's measurable, and it's reproducible in controlled trials. The third mechanism is macrophage modulation. Inside every arterial plaque, there are immune cells called macrophages that have become overwhelmed by oxidized cholesterol. They swell into what cardiologists call foam cells, and it's these foam cells that give plaque its dangerous, unstable character. Normally, macrophages are supposed to engulf debris and clear it away. But when they're overwhelmed and pro-inflammatory signals are dominant, they stay lodged in the plaque wall and secrete enzymes that erode that protective fibrous cap. Specific anti-inflammatory compounds can shift macrophage behavior from inflammatory to resolving. They essentially tell these cells to finish the cleanup job rather than contribute to the damage. This stabilizes existing plaques and reduces their rupture risk even before they physically shrink in size. The fourth mechanism is endothelial repair signaling. Your body maintains a population of circulating endothelial progenitor cells. You can think of them as an essential repair crew for arterial damage. When the endothelium is injured, these cells are supposed to mobilize from your bone marrow, travel to the damaged site and patch the lining. In people with chronic inflammation, a poor diet, or a sedentary lifestyle, this repair crew is both smaller in number and slower to respond. Specific flavonoid compounds can measurably increase both the count and the mobilization speed of these progenitor cells. It's like the difference between a city that has a full emergency maintenance team on call around the clock versus one that's been downsized to a skeleton crew. The biological equivalent of restaffing that crew is exactly what some of these morning compounds can do for you. Now, this is where things change. Let's look at what the research actually shows. A controlled trial out of the University of California, San Francisco, involving 146 adults with documented endothelial dysfunction, evaluated the effect of a specific polyphenol-rich beverage consumed each morning over 30 days. The researchers measured flow-mediated dilation, which is the gold standard for endothelial function, using high-resolution ultrasound. The participants consuming the active beverage showed a 32% improvement in flow-mediated dilation compared to the control group. They also saw significant reductions in oxidized LDL, which is the precise particle most responsible for foam cell formation. In a 12-week randomized trial from the Karolinska Institute in Sweden, researchers tracked 89 individuals with early-stage atherosclerosis confirmed by carotid intima media thickness measurements. The intervention group consumed a standardized daily dose of a quercetin and allicin-containing preparation each morning. Week 12, ultrasound measurements showed a statistically significant reduction in carotid intima media thickness, a direct structural measure of plaque burden compared to the placebo group. The researchers also observed a 28% increase in circulating endothelial progenitor cell counts. Harvard Medical School researchers analyzing data from the Nurses' Health Study and the Health Professionals Follow-Up Study identified that individuals in the highest quartile of dietary polyphenol intake had a 34% lower rate of cardiovascular events over a 20-year follow-up. This held true even after controlling for smoking, exercise, and baseline cholesterol. The most protective compounds were flavanols and organosulfur compounds, both present in concentrated form in the morning drink I'll describe in just a moment. A 2019 mechanistic study from McMaster University examined the effect of berberine on macrophage behavior in arterial tissue. researchers demonstrated that 500 milligrams of berberine daily for 8 weeks significantly shifted macrophage polarization away from the inflammatory phenotype toward the resolving 1. In practical terms, the immune cells inside plaques stopped acting like arsonists and started behaving like a professional cleanup crew. A 2021 meta-analysis published through the National Institutes of Health covering 18 randomized controlled trials found that daily consumption of nitrate-rich foods combined with flavonoid-rich beverages produced synergistic improvements in endothelial nitric oxide bioavailability. The effect was approximately 40% greater than either intervention alone. That's energy is the key. It's why the morning drink I'm about to describe works better as a specific combination than any single ingredient could ever achieve on its own. So let's build it. Here is the exact morning protocol with doses drawn directly from the clinical literature. This is not a juice cleanse or a fad. This is a targeted, biochemically justified intervention. Start with 200 milliliters, that's about 3/4 of a cup of raw beet juice as your base. Beets are among the richest dietary sources of inorganic nitrates, which your body converts into nitric oxide through a two-step process. That conversion is significantly more efficient in a fasted, slightly acidic stomach environment. This is precisely why the morning timing matters so much. Fresh pressed is ideal, but a cold-pressed bottled beet juice without added sugar works well too. Look for a product with at least 300 milligrams of nitrates per serving. Next, add 1 teaspoon of freshly grated ginger, which is about 5 grams. Gingerols and shogalls, the active compounds in ginger, inhibit platelet aggregation through a mechanism very similar to low-dose aspirin, but without the gastrointestinal side effects. They also suppress an inflammatory signaling molecule called NF-kappa B, which is one of the primary drivers of endothelial dysfunction. Add the grated ginger directly to your beet juice, or steep it briefly in warm water and then combine. Now here's the ingredient most people skip, and it's arguably the most important. Half a clove of raw garlic, finely minced or pressed, about 1.5 grams. When garlic is crushed or minced, it triggers the formation of allicin, an organosulfur compound that measurably enhances HDL functionality, inhibits LDL oxidation, and directly suppresses the inflammatory macrophage signaling that makes plaques so dangerous. Allicin degrades rapidly. You must consume it within 10 minutes of crushing. Do not use garlic powder. Do not cook it. Mince it raw, let it sit for just 60 seconds to allow the allicin to form, and then add it to your drink. If the taste is too strong, you can swallow it quickly with a small spoonful of raw honey. Then add the juice of half a lemon, about 30 milliliters. The vitamin C in fresh lemon juice does 2 things here. First, it recycles oxidized nitric oxide back into its active form, extending the vasodilatory effect of your beet juice. Second, it dramatically enhances the bioavailability of the flavonoid compounds in ginger by preventing their degradation in the gut. Please don't substitute bottled lemon juice. The vitamin C content is substantially lower after pasteurization. Stir in 1 teaspoon, 15 milliliters of raw, unfiltered apple cider vinegar. The acetic acid in it suppresses the hepatic enzyme that regulates Veldol production, which is the lipoprotein most associated with triglyceride-rich, atherogenic particles. It also creates that mildly acidic gastric environment that optimizes the nitrate to nitrite conversion. Use the unfiltered kind that contains the mother for the added polyphenol content. Add it in last and stir. If you want to amplify the anti-inflammatory effect even further, add a 1/4 teaspoon of turmeric and a small pinch of black pepper. Curcumin, the active compound in turmeric, is a potent suppressor of macrophage-mediated arterial inflammation. On its own, its bioavailability is poor, but piperine, found in black pepper, enhances curcumin absorption by up to 2,000%. That's a synergy effect documented in multiple pharmacokinetic studies. Adding a small amount of healthy fat at breakfast, like olive oil drizzled on toast, will boost absorption even further. Combine everything, stir or blend briefly, and consume it immediately. Don't let it sit. Beyond this morning drink, there are 4 supporting foods that will compound the benefit throughout your day. With lunch, have 120 milliliters of pomegranate juice or half a cup of pomegranate seeds. Pomegranate contains a class of polyphenols called punicalagins that are metabolized by your gut bacteria into urolithins. These are compounds that powerfully reduce arterial wall inflammation and support endothelial progenitor cell mobilization. A landmark Israeli study published in Clinical Nutrition followed patients with carotid artery stenosis for 3 years. Those consuming pomegranate daily showed a 35% reduction in carotid intima media thickness. The control group, however, showed an 18% increase. Those are dramatic, structural, measurable differences. 2 to 3 times per week, have 100 to 150 grams of wild-caught fatty fish, EPA and DHA, the marine omega-3s, directly incorporate into the phospholipid membranes of your endothelial cells. This increases their fluidity and reduces the rigidity that drives plaque adhesion. They also suppress leukotriene production, which are inflammatory molecules that are consistently elevated in vulnerable plaques. Frozen wild salmon is nutritionally equivalent to fresh and significantly more economical. Every single day include 2 cups of dark leafy greens, either raw or lightly steamed. Spinach, arugula, and Swiss chard are particularly high in dietary nitrates and also in lutein. Lutein is a carotenoid that has been shown in prospective studies to significantly reduce arterial inflammation, independent of its antioxidant effects. The nitrate content is highest in raw arugula. If you're cooking your greens, choose light steaming rather than boiling, which leaches those water-soluble nitrates right out into the cooking water. And daily, eat 30 grams of walnuts, just a small handful. Walnuts are the only tree nut with a truly meaningful ratio of ALA omega-3 to omega-6 fatty acids. They also contain L-arginine, the direct amino acid precursor to nitric oxide, in concentrations that measurably raise plasma levels within just 2 hours of eating them. A Penn State study found that daily walnut consumption over 6 weeks reduced both central aortic pressure and non-HDL cholesterol compared to a standard Western diet. Now let me share 5 things I tell my patients directly. These come from 15 years of clinical practice and they're insights most people never hear anywhere else. The 20-minute fasted window is not optional. The nitrate to nitric oxide conversion that makes beet juice so effective depends on certain oral bacteria. These bacteria are only present in significant concentrations before you've brushed your teeth or used mouthwash. The research is unambiguous. Using an antibacterial mouthwash before your morning drink reduces the nitric oxide yield by up to 90%. Drink first, brush after. Your oral hygiene is not compromised, you're just sequencing it correctly. Secondly, warm beats cold for vasodilation. Consuming your morning drink at a warm rather than ice-cold temperature mildly stimulates vagal tone and relaxes arterial smooth muscle even before the bioactive compounds are absorbed. This isn't a dramatic shift, but it's absolutely measurable on blood pressure monitors in a clinical setting. If straight beet juice is too intense for you initially, use warm water as your base. Third, track the right numbers. Most patients fixate solely on total cholesterol. Ask your doctor for 2 additional markers: your oxidized LDL level and your high-sensitivity C-reactive protein, or hs-CRP. Oxidized LDL is the specific lipoprotein fraction that initiates foam cell formation. High-sensitivity CRP reflects the systemic inflammatory burden that destabilizes those plaque caps. These 2 numbers tell you far more about your actual arterial risk, and they are the ones that respond most visibly to this protocol. Fourth, respect the 4-week threshold. Most people expect to feel dramatically different within a few days and they give up after 2 weeks. The vascular adaptations from dietary polyphenols and nitrates are real, but they accumulate gradually. Endothelial function improvements are typically measurable at 3 to 4 weeks. Structural changes in plaque burden take a bit longer, usually 8 to 12 weeks at minimum. I want you to commit to 4 weeks of daily consistency before you evaluate anything. Be patient and give your body the consistent signal it needs. And finally, avoid grapefruit during this protocol. Grapefruit contains compounds called furanocoumarins that inhibit the CYP3A4 enzyme. This is the same enzyme responsible for metabolizing many cardiovascular medications. If you're on statins, calcium channel blockers, or antiplatelet drugs, combining grapefruit with this protocol can unpredictably raise your medication blood levels to a dangerous point. Stick to lemon and pomegranate for your citrus. Now let's talk about the mistakes that silently derail this protocol. The most common and most damaging mistake is cooking the garlic. Allicin, the compound responsible for garlic's cardiovascular benefits, is created enzymatically only when raw garlic is crushed or minced. Heat above 60 degrees Celsius deactivates the enzyme that produces it entirely. Roasted garlic, garlic powder, and garlic salt contain essentially zero allicin. It must be raw, freshly crushed, and consumed within minutes. The honey trick I mentioned is there for a reason. Use it if you need to. The second mistake is using this protocol intermittently. Your vascular system responds to consistent biochemical signals, not occasional ones. Doing this 5 days a week and skipping the weekends produces approximately half the benefit. It's not just because of the 2 missed days, it's because the signaling pathways involved require sustained activation to produce that long-term structural change. If travel or a busy schedule disrupts your routine, simplify the drink rather than skip it entirely. The third mistake is expecting symptom feedback. Arterial plaque simply does not produce symptoms until it is very advanced or actively rupturing. This means the protocol works invisibly, which I know is psychologically very difficult. You have to anchor your feedback to those measurable numbers we discussed, your oxidized LDL and high-sensitivity CARP. The absence of symptoms is not evidence that the protocol isn't working. In fact, it is precisely the goal. And the fourth mistake is substituting supplements for whole foods. People replace raw garlic with a garlic capsule, beet juice with a nitrate tablet, ginger with an extract. The bioavailability and synergy effects from whole food forms are consistently proven to be superior in the vascular literature. The food matrix itself, the fiber, water, cofactors, and co-occurring compounds is a critical part of the mechanism. Supplements can absolutely support the protocol, but they cannot replace it. Cardiovascular disease does not have to be your inevitable fate. The people I've watched genuinely sidestep it with better scans and better biomarkers decade after decade are not just genetically fortunate outliers. They are people who made specific, consistent choices about what they put in their bodies every single morning. Your endothelium can still produce nitric oxide. Your HDL can still transport cholesterol out of plaque. Your endothelial progenitor cells are waiting in your bone marrow right now, ready to repair damage the moment you give them the biochemical signal to mobilize. These systems aren't dead. They exist inside you right now. The question is not whether your body can do this. It absolutely can. The real question is whether you are giving it what it needs to do it. 1 cup every morning consistently. That's where it starts. So let's bring everything together. Arterial plaque is not a permanent life sentence. It is a living, metabolically active structure that responds to specific biochemical inputs, including the foods you can access in your kitchen today. The 4 key mechanisms are nitric oxide restoration, reverse cholesterol transport, macrophage stabilization, and endothelial repair signaling. Your new morning drink contains 200 milliliters of beet juice for nitric oxide precursors, 5 grams of fresh ginger for platelet and inflammatory suppression, 1.5 grams of raw, freshly minced garlic for allicin-mediated HDL support, 30 milliliters of fresh lemon juice for vitamin C and flavonoid bioavailability, 15 milliliters of raw apple cider vinegar for Veldal suppression and optimal nitrate conversion, and optionally a 1/4 teaspoon of turmeric with a pinch of black pepper for curcumin-mediated macrophage modulation. Your supporting foods throughout the day are pomegranate daily, fatty fish 2 to 3 times per week, 2 cups of dark leafy greens every day, and 30 grams of walnuts. The critical rules are simple but powerful. Drink it fasted about 20 minutes before breakfast. Don't brush your teeth first. Don't cook the garlic. Track your oxidized LDL and high-sensitivity CARP, not just total cholesterol, and give it a full 4 weeks before you judge any results. Your cardiovascular future is not carved in stone by your genetics or your age. It is written in a very significant part by your daily choices. You have a remarkable amount of biological leverage here, far more than you've probably been led to believe. My hope is that you use it starting tomorrow morning. If this information was useful to you, please subscribe and give this video a like. It genuinely helps this channel reach more people who are looking for real evidence-based health content rather than just clickbait. And if you know someone who's been told their arteries are fine but deep down something still feels off, please share this with them. The gap between a normal result on a standard panel and truly protected vascular function is significant, and they deserve to know that. I'll see you in the next one. I'm Dr. Meilin. Take good care.